It is now 24 minutes past 8. We're going to talk a bit about the merging of Hollywood and medicine now, because we're used to seeing impressive special effects in some of Hollywood's biggest blockbusters. But what if that technology could also be used to benefit our health?
Scientists have adapted the motion capture suits used in the film Avatar to make the actors look like aliens, to track the progress of diseases in patients and help to speed up the development of new drugs. Here's our science correspondent, Palab Ghosh.
Very exciting, cool. Yeah. And you can see all the data's coming in and it's then being processed here by the AI. But why don't you try to shake hands with yourself?
Yanita is wearing a suit that records every one of her movements.
There you are, and it's slightly delayed. There's your hand.
She has a rare genetic disorder that makes it progressively harder for her to move as she gets older. Sensors on her suit send the data to a computer, which assesses how the disease is progressing.
I'm very excited. I mean, it looks very futuristic. I feel a bit like a robot. I think it will be amazing to be able to just put that on even at home and just be able to see your progression and how things are changing.
The suit is Professor Aldo Faisal's idea. His research shows that it can assess the severity of the disease in half the time a doctor could.
So we've developed a technology, an AI, that analyzes human movement and understands movement better than any doctor, but can also look at a patient on a 24/7 basis, like no other doctor can. The benefit is that we can diagnose patients precisely and monitor their progression in an unprecedented way.
This family is our fortress.
The idea was inspired by the motion capture suits used in the film Avatar to make actors look like aliens.
Can I get some chicken katsu, please?
In medical research, it can track a patient doing everyday
The
things.
sway in the upper body. Okay, so now she's sitting down at the table, clearly.
Doctors can get much more reliable information than they can from tests in the clinic.
And he's now much more stable.
The new technology has the potential to develop new drugs much more quickly and cheaply. Currently, to test out an experimental treatment, it needs to be tried out on at least 100 patients for around 2 years. Because the new system is much more accurate, only 15 patients are needed for around 6 months.
The motion capture suit has also been able to predict the development of Duchenne muscular dystrophy in children much more accurately than ever before.
I believe that this new system will enable drug development to be accelerated and to reach and novel therapies to reach patients much faster. So this will be a game changer for drug development.
The researchers say in the journal Nature Medicine that their new system could be used to test out the effectiveness of new drugs for any condition that affects movement, such as stroke, Parkinson's and heart disease, that could one day help patients such as Yanita. Palab Ghosh, BBC News.
We love it when Hollywood meets medicine, don't we? We're going to talk now to Yanita Opolakova, who we've just seen trying on one of those suits. And with us here is Professor Richard Festenstein, who is one of the research leaders. A very good morning to you. How did this come about then?
Oh, it was very exciting. It was a meeting by chance with Aldo Faisal, who's a professor of AI at Imperial, and we were presenting 100 years of MRC, Medical Research Council. We were looking into the future, and we were discussing what's going to happen in the future. And he was talking about AI, and I was talking about this disease, Friedreich's ataxia, where we could switch the gene back on again as a treatment for it. And he was using this technology to see how people make flints. You know, how did the Stone Age man make the first piece of technology? And I said, well, why don't we use it for patients?
And that wasn't last week. How long ago was that? That
was at least 10 years ago.
So that's the kind of time spans we're working on.
Well, it took us that length of time to get, we had to get approval to use it, but immediately we were rushing off into the clinic, setting up a one-bedroom flat at the Imperial College Research Facility, and getting the patients from Ataxia UK, from the Ataxia accredited clinic, at the National Hospital for Neurology, where Paola Jonti, a colleague of mine, works. And we've collected lots of patients with this condition that Yanita has. In fact, that's where she comes from. She's one of Paola's patients.
Shall we ask Yanita? Yanita, morning to you. Thank you for joining us this morning. Just explain how you think this has helped you already.
Yeah, I think that's, as you saw, that's very exciting. First of all, it looks amazing. And to be honest, it feels amazing to wear it as well and kind of see yourself in every movement you make, kind of real time on camera. But I think it'll be great. I personally, I feel very strongly about developing research for especially some of the more rare conditions like Friedreich's ataxia, but also many other uh, kind of neurological conditions that have no treatment or cure at the minute. So I think basically anything that would make that process faster and easier to get to that treatment basically will be amazing for patients and selfishly for me as well.
Yeah, of course. What does it feel like wearing it?
Yeah, it is pretty exciting. So at first it feels a bit strange, as you can imagine, being strapped with a bunch of sensors. But to be honest, after a few minutes wearing it, you kind of forget that you're wearing basically a vest with a bunch of sensors. So afterwards, it's just exciting. You basically can see every minor movement that you make, even while you're sitting, just swaying lightly or just turning your head. It's just really, really impressive.
And Professor, being able to see these incremental changes that you can't maybe see with the naked eye, that's essentially what you're now able to do, isn't it? How is that helping you ultimately, hopefully, possibly to find a cure?
Well, I think the most important aspect of it is the accuracy of the measurements and the relevance of the measurements for the patients. I mean, doctors are doing this kind of thing. You saw in the film I was demonstrating this, I think. I didn't see the film.
Yeah.
These are very useful scores that you can make, but the motion capture technology can do it much more accurately. Okay. So you need many fewer patients in order to measure effect. That means that, you know, if you have a rare disease, 1 in 50,000 people have Friedreich's ataxia. That means we have about 1,000 people at any moment in the UK. We need 220 people over 2 years to measure the efficacy, the effect of a treatment.
Okay.
With this technology, we can halve it. We can use half the number of patients or half the length of time.
And it's not just Friedreich ataxia,
No.
is it? When you think about wider things like muscular dystrophy,
Indeed.
other conditions.
Yeah, exactly. So we were able to immediately go on and apply the same technology to Duchenne muscular dystrophy, which people may have heard of. It affects boys and it comes on early. It's a really horrible, devastating disease. And there also is no cure for that. But people are developing new approaches. Lots of new things like gene therapy. And if we want to test them, we need things like this, which are not just relevant for measuring what the clinician wants to measure, but also measure at home what people normally do. So, you know, doing that is one thing, but picking up a cup like this
the motor
is another
skills
thing.
are different again.
And then you've got all of those bits of data.
Yes, so we've got all that data and we can give sensors to people to wear at home. Which means that we can actually see what impact this is having on their daily lives.
And Unita, that's the key point there that the professor just made. What effect does this have on your daily life? How are you?
Yeah, I think it'll be really quite useful to know basically how your movements change on a day-to-day basis. Just because there are just a lot of environmental and external effects to basically how you feel, whether you're tired or whatnot. Just being able to monitor that even at home, I think it will be very useful, and you would know kind of how to adapt your lifestyle to essentially feel better and be better on a daily basis.
Unita, you're our real life avatar, and all of your data is going to go down in history.
Yes, I think that's very exciting. I feel quite honored.
You can see how excited she is to be part of it. It's fantastic.
Unita's been really, really helpful with demonstrating this technology and is a really great advocate. She's also on the Ataxia UK who are the charity that is doing that. She's involved in helping them to raise funds, and we need money, of course, to do all of this kind of thing.
Oh, we'll stay in touch as it all collates together. The data, you must let us know how it's helping with the treatment. Thank you, Unita.
Thanks, Unita.
And thank you, Professor, for coming in.
You.